As part of the response to the coronavirus outbreak, the Massachusetts Health Connector has extended its deadline for open enrollment to April 25th. The connector helps identify more affordable options and coverage for individuals and small businesses. To tell us about the process and some of the options is the connector's Director of Communications, Jason Lefferts. Thank you very much for joining us, Jason.
Thanks for having me, Chris. Good to see you.
And good to see you too, still working. I want to ask you about what the connector is. I know the word health insurance marketplace is used. So what exactly does that mean?
Sure. So we're the state exchange in Massachusetts. Many people get their health insurance from their work. In Massachusetts, we have a lot of people who work on their own. They're sort of self-employed in the gig economy. Or some people, especially right now, are losing their jobs and they need health insurance. And they can come to us and they can get enrolled in coverage. They can also, for a lot of people, get access to help paying for their health insurance. We have a program that we call Connector Care for people who make about $37,000 a year or less in their current income. Can get help through low premiums and copays and $0 deductibles. So it helps make health insurance and access to care easier for people if they don't have a job, particularly right now.
No, there are many people who don't have insurance. Ordinarily would say, I'm going to table that. It's not a big problem right now, but how much of a difference does it make to not have insurance if something happens?
So I think right now, health and wellness awareness is at about an all-time high, right? I mean, people understand what's going on outside in terms of the coronavirus. And I think that more than ever, people understand the need to have health insurance. It makes it easier to go to the doctor and get treatment for, anything really. Obviously, it's not just the coronavirus, but in the long run, there's the flu, there's other illnesses, people get hurt, and people need that access. It's just, it makes it affordable to go to the doctor when you have health insurance. Otherwise, you're looking at big bills.
Right. And of course, the other thing is about current income. Now, in ordinary times, current income means you simply download last year's tax returns,
Right.
and that's it. A lot has changed for people since then. So what does that mean? Let's say if they just lost a job or if they've just been furloughed.
Right. So the way our application process works and our account process works is that people who need to come in and have coverage or already have coverage can come in and they can tell us how much money they're making right now. So if you're on unemployment, we want to know about that. But obviously, if you don't have a job, you don't have other income to report. And we want to know what you expect to make in the calendar year. So right now, if you were just laid off, if you don't have a job right now, you can come in and tell us what you're making for unemployment. You can, factor that out. This is what I think I'm going to be making for the rest of the year based on your current situation, right? You don't have to expect I'm going to have my job back on May 1st or June 1st or some other date. This is where I am at this point in time. You tell us where you are, and we will factor that in and determine what program you're eligible for. And that could include Connector Care, which, like I said, provides a lot of help in terms of paying for health insurance. It can also include Mass Health. It's one application for both Connector coverage and Mass Health coverage.
Now, I imagine this could make a big difference for people in sectors in the gig economy, whether it's Uber drivers, people who work in the food sector. For those people, I think there's been this just abrupt drop, right?
Yeah, exactly. I think, obviously, the economy has, this thing has impacted a lot of people in a number of different professions. We know restaurant workers, for example, a lot of them aren't working anymore. Even in places that are open are cutting back on their staff. Certainly an Uber driver is probably seeing a lot less business. I think we've all seen the pictures and videos of downtown Boston, for example. There are no people, there are no cars, everyone's doing the right thing and they're not being out. That means that these people are losing income. And if they're a current member, if they already are a health, if there's an Uber driver who is already a Health Connector member and they're seeing a loss in income, we want to know about that because we want to make sure that their coverage stays affordable in their current circumstances.
Now, I want to make that extra clear. That means if you already have coverage and you think your plan is actually pretty good, you should come back and revisit, right?
Yeah, absolutely. Look, health insurance, we try to make health insurance as affordable as possible. And Connector Care coverage is a good deal. But if but if you're experiencing a severe loss in income, that premium doesn't look as good today as it did a month ago or 2 months ago. We want to make sure that premium looks better for people. So we are really encouraging our current members, if their income has changed in the last few weeks or a month, come in, make that update, let us know where things stand, and we can get you hopefully into a better program to suit your needs.
Once people go to the connector, there is something they can do on their own as far as comparisons. How does that work?
So people go through the process. They give us all their information. We tell them what program they are put into. If it's an unsubsidized plan, there's up to 50 plans, but there's plenty of ways to compare those plans, by sort of benefit level, by price, by carrier. People can do that research right there. It's sort of one stop. You can look at all the carriers and all the plans at once. For connector care, depending on where you live, there's typically 3 to 5 plans that you can choose from. And at least one of those plans, more often than not, 2 of those plans are sort of at the lowest cost. We have something we call an affordability schedule. So they're typically 2 plans at the lowest cost level, and people can pick that plan, know they have good commercial coverage at the lowest possible price.
Is there any capacity for helping people who speak other languages as their first language?
Yeah, so people can call our call center. It's 877-MA-ENROLL. We have language capacity for any language. People can also reach out to our navigator agencies. These are local, a lot of them are healthcare organizations. They are still helping out clients at this point. They're not doing as much in-person, almost no in-person work at this point, obviously because of what's going on, but people can call the Boston Public Health Commission. Is the big one in Boston. You can call the Boston Public Health Commission, and you can get on the phone with the navigator, and they can walk you through the process and help you get enrolled or update your information if you're a current member and need to do that.
What's the volume been like as far as people trying to either enroll or ask for help in some way?
Yeah, so we have about 300,000 members right now. We haven't seen a sharp increase in enrollments yet. We do expect to see that over the next few months. We are seeing a lot of member activity, though. We have seen tens of thousands of people come in and update their income just over the last 3 weeks. We kind of got that message out to people, update, and we are seeing a lot of activity there.
Now, I know a lot of people are very focused on the coronavirus, and we have these scenarios in our heads. What if I have to go to a hospital? But what about other health problems? Let's say mental health or even substance use disorder. Can this program help with that?
Yes, absolutely. So these, like I said, these are commercial plans from all the carriers that in the state. And the state has good minimum credible coverage standards for substance abuse, behavioral health, mental health, along with regular visits to the doctor.
What's it been like for people working with the connector? And I know this is the state program itself, but I know you have these connections to other people who may handle the calls. Is this a tough time for people to work because they have to do things differently? What has it been like?
Yeah, I think like everyone else, we've been adjusting to working at home. I think it's been a couple weeks. I think it's getting better for us. But fundamentally, our system and our process hasn't changed for people. So if they call our call center, if they reach out to a navigator, they lose that kind of direct in-person helpfulness. So it's always great for people to sit down across from someone face to face and do this, but they can get on the phone and they can get the help they need.
Now, of course, there was a decision to extend the deadline for open enrollment. Take me back a little bit to when people made that decision and what was going on at the time.
Sure. So we made the decision in early March to extend our enrollment to anyone who doesn't have coverage. It was first through April 25th. We've since extended even that to May 25th. So people have until May 25th at this point.
I'm glad you brought that up because I was going with the earlier date there.
Yeah. So anyone who doesn't have coverage and needs it, they have until May 25th. The deadline for May 1st coverage is April 23rd. So April 23rd is sort of the next deadline. But we saw that the Division of Insurance required carriers to make testing and treatment mandatory and no cost on the coronavirus. And we wanted to make sure that everyone had access to that if they need it or think they might need it in the future. I think we know that more than ever, having health insurance is really on people's minds, and we wanted to make sure anybody who wanted it could get it. So that's why we extended enrollment now at least through May 25th.
And finally, if people want to pursue this online or by phone, what's the best way to do that?
Yeah, so the website is mahealthconnector.org. You can go on obviously anytime and go through the application. If you start to go through it and you have some problems and you need some help, you can call us at our customer service center at 877-MA-ENROLL. You can also find local navigators on the website. Those are those community organizations I was talking about. You can give them a call and they can help you as well.